Hey, Anna, absolutely phenomenal. We'll have an amazing time today, as usual. All right. So we are expecting more people to join. So if you have a friend who is meant to join us today and they are not here yet, you want to get them into this session. All right. Loud and clear from Adegbite. We'll be looking at the career opportunities in health tech. Health tech is a career path you want to move into. If you have healthcare experience or you don't, I'll be showing you how to get started. We'll have an amazing time and have the opportunity for questions and answers before we wrap up today. Okay, so let's get right into it and let's get cracking with the session today. I'll do a little bit of introduction as we move on. If you have questions, I have my colleagues in the chat. Feel free to send your questions into the chat. But before we leave this place today, I'll walk through all the questions you have and I'll provide answers to them. All right. So, career opportunities in health tech in 2026, the skills that you need to land a job. But beyond the skills, you need a little bit more. All right. And I'll be showing you those extra things that makes the difference for professionals transitioning into this career path. So why are we here today? That's the big question. We have different categories of people in this session today. So many of you that have joined and some of you that will join much later. We have people who want to work from home. We have parents, we have mothers, we have fathers, moms and dads who want more flexibility in the way they work, their jobs. You want to be more present at home, spend more time with your family, have a flexible work approach. You want a career without necessarily sacrificing your health and also your family. Okay, so we have career switchers moving from healthcare into the tech ecosystem. And we also have professionals who are not in healthcare, but want a career path in health tech. So how do you start? Okay, this is one of the reasons why we are here. We also have some of you who are burnt out. You are drained physically, you are strained, you are tired of the bedside care, you are exhausted. You want to get into the tech ecosystem, but you don't know where to start. There is that confusion of, I don't know where to start, I don't know what to do. And that's why you're here today. Okay. Some of you are nurses, you are healthcare assistants, you are health nurse practitioners, physicians, support worker, care workers. You've worked in healthcare. You want to transition, but you are scared of starting over. You don't know what it would look like if you start from scratch and how to make the jump into the health tech space. And of course, finally, you have valuable domain knowledge. You have 5 years experience as a nurse, 2 years experience. You've worked as a physician. You've done your master's in public health, or you don't have experience in any of these areas, but you don't know how to use it to your advantage, especially for those of you that have domain knowledge. So some of the things I'll be showing you today is I'll show you how to convert your healthcare experience to a job in tech and how you can do this within the space of 6 to 8 months. And I would also show you how to learn the skills required to land a job in health tech. What skills do you need and how do you learn those skills? I'd walk you through that. And I would also show you how to gain the experience that you need to land a job, to show employers that you're the best candidate for that job. Because employers want more than just your skills. They want to see that you have experience in that career path. And that gives them the confidence to give you that opportunity within that space. And finally, I'll show you how to land jobs, where to apply to jobs, how to land jobs, and how to get started today, no matter where you are across the globe. You're in Europe, you're in the US, you're in Canada, you're in Ireland, you're in the UK. How do you start today? Okay. So these are the things I'll be showing you. I want you to take off all distractions, go somewhere quiet, take out a notepad, make sure you have a pen, take things down, ask your questions, and I'll be very happy to take all the questions that we have. Can we have the recording? Absolutely, Aderonke. You can have the recording, but those that would get the recording are the people who fill the attendance form. So my colleagues would share attendance from time to time. Make sure you fill the attendance in the chat. So you get all the materials, all the recording, all the slides, everything I'll be sharing with you today. So my job today is simple, and that's to show you that there are numerous opportunities for you And I'll show you how to get started within the shortest period possible, 6 to 8 months. And for those of you meeting us for the first time at Tenalytics, we are the leading educational technology company focused on helping people land high paying jobs, transition into high paying careers within the tech ecosystem. Over the last 5 years, we've helped over 3,400 people with no prior tech background, no knowledge about technology, the technology ecosystem, but we've been able to help them transition over 3,400 and cutting across the UK, the US, Canada, across Europe, Africa, Asia, and so on and so forth. And for me, leading the session today, my name is Adeza Suleiman. I'm a technology expert with over a decade experience cutting across data analytics, management consulting, data engineering, and data science. As the founder of Tenalytics and the co-founder of Amdari, I've been able to help over 3,400 people make the transition just like myself. So for so many people, you'll be wondering, did Adeza study computer science or did Adeza study something related to technology? No, I studied industrial chemistry. That was my first degree, industrial chemistry. Okay. So I had no knowledge. I had no background in tech, but I was able to make the transition. And it dawned on me that there were so many other people within the same bucket. When I worked for companies, when I moved to the UK, worked for organizations in the UK, I was the only African on the team, the only Nigerian on the team. But how do we get more people that look like me to get into the tech ecosystem? And that was where Tenalytics came about. Amdari also came about. And today we've helped over 3,400 people like me transition into the tech ecosystem who had no knowledge, no background in tech, but made that transition. And I've also currently work as a data analytics, data engineering contractor in Canada. I've lived and I've worked in the UK as a data science consultant, customer insights analyst. I've worked remotely for companies in the US back when I was in Nigeria. And I've worked as a data analyst, management information systems analyst with one of the largest energy conglomerates in sub-Saharan Africa. And I've also worked as a data analytics consultant with FITC, owned by the Bankers Committee and the Central Bank of Nigeria. I've worked across multiple sectors, from automobile to educational technology to financial services and so on and so forth. Okay. And I'll bring my experience into play as we move on today. Right? Now, one of the things you want to do when transitioning into the health tech ecosystem, and this is number one of a four-part strategy on making the transition. So we have a four-part strategy I'll be working with you today. I'll be sharing with you. The first one is high demand roles, getting into a high demand career path. So career path within health tech is super high in demand, no matter where you are. If you are in the UK, the NHS hires the largest number of talents across the UK. If you are in the US, the health tech ecosystem is booming with so many opportunities. Same in Canada, same in Ireland, same across Africa, and so on and so forth. So one of the first things you want to do is getting into a high demand career path, which means you make getting a job 10 times easier when you're in a career path that employers are actively searching for. So if I need to get a job today, the first thing I'll do is get into a career path that I know that employers are actively searching for. I position myself and the chances that I'll get an opportunity is a lot higher if I find myself in a career path that has a low demand across board. So when you look at health tech, there are so many high demand career paths within the ecosystem, and I'll share a couple of them with you. The healthcare business analysts, the healthcare informatics specialists, the healthcare data and reporting analyst, the medical data analyst, the healthcare data analyst, the clinical data analyst, pathology data analyst, clinical decision support analyst, medical imaging analyst, healthcare AI engineer. And there's so many other career paths. I just listed 10 of them. There's so many more. So when you find yourself in any of these areas, one thing happens. you put yourself in a position to land a job a lot faster. You put yourself in a position to land a job that is progressive. You can work from home, go to the office twice a week, 3 times a week, work from home twice a week. You have a hybrid, flexible approach to work, and you have a career path that does not require progression, that does not require you to have to work physically. Okay. You don't have to do more physical work in order to earn more and progress in your career. That's what health tech does for you. Now, if you look at the different career paths I've listed, you'd see that data is a common denominator. Clinical data analyst, pathology data analyst, medical data analyst, healthcare data and reporting analyst, healthcare data analyst. Data is a common denominator. All right. And this shows you that with your healthcare background, for those of you who are in healthcare already, you are a nurse, you are a medical doctor, you are a physician, you are a nurse practitioner, you've worked in care. You find yourself with the domain knowledge. You have domain knowledge. You have goals in your hands, but you don't know because you have the knowledge of the sector. And when you add data analytics skills to that, you find yourself with a unique set of skills that so many people want to get. Okay. So when you look at the demand across, but I did just a very quick search on the NHS yesterday evening while I was working on my slides for this session. Okay. I just went to NHS jobs and did a search for data analytics. 3,080 jobs are currently available. Information analysts, healthcare data analysts, and so many other roles. And when you talk about the pay, the remuneration is also absolutely fantastic. High paying roles, high demand roles. Okay, the NHS currently recruiting for a band 7 role, pharmacy, clinical, informatics, and data analysts. That's a mouthful. So you'd see these different job titles that are all tilted towards healthcare. But guess what? They are within the tech ecosystem. Pharmacy, clinical, informatics, and data analyst. And the salary is about £56,000 to £63,000 per annum. You also have one of the NHS trusts recruiting as well, a band 5 role for a medical devices analyst. If you go to the US, you go to Canada, the same thing. And I'll be showing you a platform today that is phenomenal when it comes to job search and applying to get a job. So what we do, and we do very well at Analytics, is showing you where to apply. Where do I find these jobs apart from the NHS? There are so many medical institutions, insurance medical institutions across board, and how to look for these roles, apply to them and get opportunities. Okay. In the US, for example, this is an entry level role. The salary is about $105,000 to $130,000 for a healthcare data analyst. You have job titles like the clinical analyst, healthcare software. Again, fantastic salary as well. So high demand and high paying. So when you look across board, you find out that in the UK, the average salary for the health tech professional is about £36,000 to £60,000 per annum. It could be more, it could be less. Take, for example, if you look at this particular job role of the pharmacy, clinical informatics, and data analyst, it's up to £63,000, over £60,000. And there's so many other roles that are above that. Okay. So the average, looking at entry-level roles, looking at the mid-level roles, and so on and so forth, you have an average of about 36,000 to 60,000 pounds. In Canada, about 66,000 Canadian dollars to 106,000 Canadian dollars. And in the US, about $80,000 to $173,000. So like I said, number one is get into a high demand, high paying career path and position yourself for opportunities. If you do that, you'd see yourself transitioning from a healthcare assistant to what? A medical data analyst, a healthcare data analyst, and so on and so forth, a pathology data analyst, because these are roles that employers are actively searching for. Okay, so pray do you have your hand up? I'm going to take questions at the end after I've done my presentation. Okay, so make a note of your question. I'll come back to take that question when we get to the Q&A section. Okay, so position yourself. That's very important. And that's exactly what Sharon did. Sharon worked with the NHS as a healthcare assistant, but she wanted more. She wanted to move from being a healthcare assistant. She wanted to transition into health tech. And she was able to do this in about 3 months. I've given you a timeline of 6 to 8 months. Sharon did it in 3 months. Sharon joined us in March 2025, March last year. We worked with Sharon using a framework I'm going to share with you. Okay. So Sharon joined us in March 2025 to learn to transition into health tech from a healthcare assistant with the NHS. We positioned Sharon. How did we do that? We tailored her CV to the roles she was applying to. She joined all the mentorship sessions. We worked with her on strategies on how to apply internally within the organization you currently work and also externally to other opportunities that you'll find on job boards that are not accessible to the general public. So we worked with Sharon. She learned, we positioned her. And what did she do? She applied to jobs, multiple jobs. And in May 2025, Sharon landed a job as a business data analyst. Just after 3 months of joining, she hadn't completed her program yet. She hadn't gotten into the internship. We prepped her for the first stage, the second stage, the third stage interview. And when it came to the point of referencing, we wrote a reference for her, and Sharon was able to land this job. You have somebody like Pavel. Sharon had healthcare background. She came from the NHS. She worked as a healthcare assistant. Pavel, on the other hand, had no experience in healthcare. He was a teacher in Cameroon before he moved to the US. And when he needed to land a job, what did he do? He looked for where the opportunities were. Where would I easily land a job, find opportunities? What are the career paths that are in high demand within the area I currently stay? And what happened? Pavel came to us. He joined our data analytics program. He finished his program in December 2024. We packaged Pavel, positioned him, tailored his CV to a healthcare data analyst CV. He joined all the mentorship sessions. We prepped him for multiple interviews. I helped Pavel negotiate the salary before he got that job. Of course, he applied to multiple roles. He had a lot of interview preparation. And in March 2025, last year, Pavel landed a job as a healthcare data analyst with the Arizona Community Physicians in the US. I'm going to share Pavel's LinkedIn profile so we have a look at how Pavel was able to make that transition. Okay, so one thing you would see that is common between Sharon, who was a healthcare assistant, now a business data analyst, and Pavel, who was a teacher in Cameroon, moved to the US. Now he's a healthcare data and reporting analyst. They started by learning. And after learning, or while learning, what next? Packaging, tailored CV, optimized LinkedIn, mentorship, interview prep, knowing what to say when you get into the room in front of your potential employers. And what next? Apply. And after applying to jobs, what next? You get the job. So we use the LPA framework. I'm going to double down on that as we move on. That's common between Sharon and Pavel. And of course, you also have Ikmat. Ikmat was a stay-at-home mom. So I'm going to come back and I'll play some of the videos because these amazing professionals created videos that you can listen to. You hear their story. You know exactly what they did. What did they do right that made them make this transition? How did Pavel from a teacher become a healthcare data analyst in the US? How did he do it? And how did Ikmat, who was a stay-at-home mom for about 4 years, she moved to the UK for her master's in public health. And while she was undergoing her master's, she realized very quickly that the jobs I see on the NHS jobs websites requires the use of Excel. They require the use of SQL. I don't have these skills and I'm not learning them in my master's. So what did she do? Ikmat joined the data analytics program. She wanted more. She also wanted sponsorship in the UK. She joined the data analytics program. She also wanted sponsorship. And in January 2024, she did not just land a job with the NHS, she also got sponsorship, full visa sponsorship as an information analyst with the NHS. So I'd go back to the first point of today, which is get into a high demand career path. And if you are in the healthcare space, it means you already have one thing working for you, which is the domain knowledge. And if you don't, and you're like Pavel, no problem. You will learn the KPIs, the metrics that are important within the health tech space. So when you find yourself in interviews, you know how to answer the questions that would come your way. And I'm going to show you how to do that. Okay. So these amazing professionals did this, and that was how they were able to transition. Ikmat, I remember her interview prep. It was as if the person that prepared her for the interview saw into the future, all the questions that were going to be asked, prepped her for the questions. She went into the room and it was like every single question that came her way, she answered them. And I want to tell you something interesting about Ikmat. I'll probably play her video for you as well before we leave here today. At that time, the NHS were recruiting for somebody who could use Excel and who could use SQL. These were the two major technologies that they wanted for the information analyst role. Ikmat had not completed her program when she applied. She was about, I think, 2 months or 3 months into her program, but she had done Excel and SQL already. So we encouraged her to go ahead and apply. While she was undergoing the application process, she started learning Power BI with us. So when she got into the interview, she told them that you want Excel and you want SQL. I'm going to come in and implement Power BI reports to the reporting I'll have to carry out if I get this job. And they were super impressed that they were getting a candidate that didn't just have what they wanted, but she had extra, which was Power BI, that Ikmat was still learning at that time. She had put in the application and was undergoing the interview. And of course, Ikmat landed that job and she's doing phenomenally well today. Now, before I move to the second thing you have to do when making a transition, important steps, I want us to quickly go to, I promise to show you Pavel's profile and also perhaps Ikmat as well, but let's go to Ikmat very quickly. So Ikmat, again, that's Ikmat right there. And you'd see one of the things you'd see on our profile, you both worked at Analytics, and Ikmat worked with us, of course, because one of the things you show is that you have the experience. And the way Ikmat was able to show that she had the experience was to showcase that she had worked with us in that capacity, worked with Analytics as a data analyst, and she landed this job as an information analyst with the NHS. Came with full visa sponsorship. And of course, you have Pavel. Pavel moved from Cameroon, moved to the US, and Pavel landed a job as a healthcare data and reporting analyst, okay, with the Arizona community physicians. Prior to that, what did he do? Data analytics with Tenalytics. So this is positioning. They didn't do this because they thought they felt this is what they needed to do. No, they did it because part of the advice we gave to them was positioning, showcase to the employer. You're not going to tell them what you can do, but show them what you have done and what you are doing. Very important. So that's number one. The second part is how you learn the skills. Okay, you have to learn the skills. So now you want to move into health tech. You want to get a job as a healthcare data analyst, as a pathology data analyst, and so on and so forth. How do you learn the skills to land a job in that space? A lot of people, I've seen them make several mistakes. So I'm going to show you the skills you need to learn. But before we do that, we'll look at what the healthcare data analyst actually does, because a lot of people are confused. What does Ikmat do that landed a job with the NHS? What does Pavel, that works as a healthcare data and reporting analyst, what does he do really? So I'm going to show you what they do. We'll work together to identify the roles and responsibilities, and then I'll give you the skills you need to learn and the best way for you to learn those skills. Okay. So what does a healthcare data analyst do? Very good question. And we're going to answer this question using a simple case study, a case study of a mid-size hospital that is currently facing ICU congestion. I need you to work with me on this, okay? So pay very close attention so that we have an interactive session here, all right? So a mid-sized hospital is currently facing ICU congestion, bed shortages, and rising inpatient costs. To improve bed utilization, patient flow, and cost efficiency, and the quality of care, the hospital leadership wants to know how the length of stay varies by medical condition, by department, and bed type. So this hospital is facing some challenges: congestion in the ICU, congestion, and increasing costs of patients in the hospital. So the leadership wants to know how does the length of stay vary by medical condition? Somebody who has a headache and somebody who has a heart attack, what's the difference between the length of stay in the hospital? How does it vary by department? Does oncology or does gynecology have a longer length of stay compared to orthopedics, for example? And how does it vary by bed type? We want to know. So we're going to answer 3 questions. Which medical condition has the longest length of stay? Which department has the longest length of stay? And which type of beds have the longest length of stay? And we're going to do it together. All right. Remember, you want to fill the attendance so you don't miss out on the recording. So my colleague Arafat, you'd see Arafat in the chat, Arafat Tenalytics, Oluwadamilola. Those are my colleagues, Elijah. You'd find them in the chat. Make sure you fill the attendance so you don't miss out on my material. The slides, I'll be sharing them with you today. The recording, you get them as well. And of course, you'd have the links to watch all the amazing professionals that I'll be showcasing today as well. Now, let's start with answering these questions. Question number 1. We have the data, okay? So every hospital would have a hospital information system, a hospital management system, and so on. We've gotten the data from one of the databases, and we want to know which medical condition has the longest length of stay. So this is the medical condition right here, colon F. Okay, so walk with me. The medical condition, colon F, and you have the length of stay, colon E. So I want you to tell me, type into the chat, which medical condition has the longest length of stay. Just type. As it comes to you, just type. As it comes to you, just type. Okay? So which medical condition has the longest length of stay? I'd like to get your feedback. Okay? Marufat says heart disease. Somebody says cancer. Choma says cancer. Adejoke says stroke. So we have 3 different answers already: stroke, heart disease, cancer. Okay. Audrey says heart attack. Ronti says heart disease. Oluwatosin, heart disease. Stroke, heart disease, stroke. Okay. So different answers essentially, which can be, we can be confused by the different answers. Some say stroke, some says heart disease, some say, so many things we've said so far. Now let's park that somewhere. Okay. We've all responded. If you haven't responded, please feel free. Go ahead, respond. Let's have an amazing time together. Okay. Justin says cancer. Thanks, Justin. Severe trauma from Erica. Heart disease and trauma. Okay. Brilliant. Now let's go to question number 2. We've tried with question number 1. If you didn't attempt question number 1, try to attempt question number 2. All right. Which department has the longest length of stay? Now, here's the department, colon G. and here's the length of stay. So which department has the longest length of stay? Just again, as it occurs to you, type into the chat cardiology, neurology, oncology, cardiology, um, okay, neurology, orthopedic. Again, we have multiple answers. Okay, we're going somewhere with this. We're going somewhere. So that's question number 2. Now let's answer the final question for this particular case study. The final question. What type of beds? Now here's the hospital beds and here's the length of stay. What type of beds have the longest length of stay? Again, type into the chat. Type into the chat what type of beds have the longest length of stay. ICU from Oluwatosin, general bed, orthopedic. Okay, so I'm just going to mute everyone so we don't have distractions. Let's keep it coming. General ward, ICU. So now we have different answers. Okay, it's as if we all have our opinion on these questions. Okay, so I can have an opinion. Erica can have an opinion. Choma can have an opinion. Buki can have an opinion. Predu can have an opinion. All right. Now, what the healthcare data analyst does in this situation is they take this data that is messy, causing confusion. Everybody has an opinion on what the correct answer is. They take the data, they analyze the data using tools and technologies like Excel, Power BI, Tableau, and they come up with insights that look like this, a report or a dashboard that looks like this. So I'm going to ask the questions again. Okay. And this is question number 1. I want you to focus on this chart for question number 1. Which medical condition has the longest length of stay? Which medical condition has the longest length of stay? Tumor, 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 tumor. Amarachi says tumor. Yawande says tumor. Oluwatosin tumor. Manuel tumor. Now the answers are uniform. Why? Because we no longer have a messy data. We now have a dashboard that is clear to everyone. Okay, so absolutely, you are all correct. It's tumor, the medical condition with the longest length of stay. Now, let's go to question number 2 again. Which department has the longest length of stay? You have the department here. That's the chart for the department. So type into the chart which department has the longest length of stay. Oncology. Amarachi says oncology. Owodo says oncology. Victor, oncology, oncology, oncology. Absolutely. Once again, you are all correct. Our answers are more uniform now. Why? Because we can see it clearly. Okay. And finally, what type of beds have the longest length of stay? That's number 3 right here. So I want you to focus on this and tell me what type of beds have the longest length of stay. Private room, Victor, Olukemi, private room, Binta, private room, Yewande, private room. Fantastic. And that's the answer, private room. So what does the healthcare data analyst do? They take data that looks messy, confusing, where we all had different opinions. It was as if it was an opinion challenge. Okay, who has the better opinion? They take the data, they analyze the data and extract information, insights in the form of a dashboard like this, so that the leadership of that hospital or the leadership of that medical institution can look at this, understand what the data says, and take a decision. That's what a healthcare data analyst would do in any organization. Okay. So a healthcare data analyst is a professional who analyzes healthcare data, clinical data, medical records to support better medical decision. They help to reduce costs. They help to improve operational efficiency and the outcomes, patient outcomes in medical organizations. They get to work in different organizations from hospitals, government health agencies, public health agencies, health tech, pharmaceutical companies, NGOs, health insurance companies, and so on and so forth. So a healthcare data analyst takes the messy data, transform the data by analyzing the data, extracting information and insights that can help the leadership take decisions based on the analysis. Now, I'm going to ask a question before we move on. Remember, we are looking at the skills of the healthcare data analyst. Okay. Going through this exercise, do you have a better understanding of what the healthcare data analyst does in any organization? Type a yes, type a no in the chat if you have a better understanding now. Brilliant. Definitely yes. Yes, yes, yes. Amarachi says definitely yes. I totally agree with you. Okay. So, of course, they have more responsibilities that are similar to this because it's not all the time the data would be available. So, you need to think, how do we get the data? Where is the data? How do we get the data? And so on. Okay. But just to summarize, this is what the healthcare data analyst would do in a typical organization. So the mistakes a lot of people make when trying to transition is you watch a lot of videos. You learn by watching videos. It's a big mistake. If before you became a nurse or a nurse practitioner or a physician or a care worker or before you worked in healthcare, you didn't just watch videos. You also got your hands busy and you did the job. So you can't become a health tech professional by just watching videos. It's a mistake people make. I can do it by watching YouTube. I can do it by watching Udemy. It's a big mistake. I've been there myself when trying to transition into data analytics. And it took me a lot of blood and sweat because I made mistakes. I didn't have anybody to ask questions. When I had my interviews, Udemy was not in my interview preparation. I had to figure things out myself. ICMATs that landed a job had interview prep. Pavel, who was a teacher that landed a job, had professionals prepping him for those interviews. Sharon, who was a healthcare assistant with the NHS, and today she transitioned into health tech, had professionals preparing her for interviews. You need more than just watching videos. Another big mistake is no real projects. Okay, so you've never seen healthcare data, you've never analyzed healthcare data before. So, how do you know the metrics? What would an organization, a healthcare organization, look out for? What are the metrics they like to look at? What do they want to identify? What questions do they want answered? If you haven't worked on those projects, you'd struggle to answer those questions. You don't have local work experience in health tech. So if you look at Ikmat's profile, she had 10 analytics. Pavel had 10 analytics. And the reason is very simple. You must show that you know and understand the data, you understand the nuances within the region where you want to get that job. If it's in the UK, you want to know what are the health regulations within the UK, the GDPR, for example. If you're in the US, you want to understand that space in the healthcare space. You want to know what HIPAA is all about. You want to know what FIPA is all about if you're in Canada, and so on and so forth. So local experience is very, very important. And of course, you can't use a generic CV or a generic LinkedIn profile to land a job in health tech. You need tailored CVs and optimized LinkedIn profile. And finally, if you don't have a mentor to prep you for interviews, to tell you where you're likely going to make mistakes, you will find yourself circling around the same issues and the same problem until you get frustrated and drop off. Okay. So you don't want to make these mistakes. So knowing what the healthcare data analyst does and knowing the mistakes that are common across people, the skills you need to have to transition, two broad skills. Number one is your domain knowledge in healthcare. And these are for people that have knowledge in the healthcare space. Okay, you've done stuff in healthcare, you have a master's in healthcare, you've worked, in the health in a healthcare organization or a healthcare institution. You have some domain knowledge. This is gold if you have it. Now, if you don't have it, it doesn't mean that you cannot also transition and get a job. Pavel was a teacher. He had no idea on what healthcare was all about, but today is a healthcare data and reporting analyst. So you can also equip yourself with domain knowledge by working on projects within that domain. And I'll walk you through practically how to do that. Okay. So the first broad skill you need is domain knowledge. The second is data analytics. And for your data analytics skills, you need a couple of key learning areas under that. First of all, is problem solving. Every organization in this world solves a problem. The hospitals solve problems. NGOs solve problems. Financial institutions solve problems. So you must understand, how do I break problems into multiple parts? How do I identify that this is a problem? How do I get to the roots of that problem using techniques like the 5 whys? How do I break problems into multiple parts and prioritize on the smaller chunks and eventually solve the entire problem? How do I use techniques like the McKinsey MISI model? How do I use the prioritization matrix to know what to prioritize, and so on and so forth? Okay, so it all starts from problem solving. That's where you start from. How do I know if we have the records, the medical records, the healthcare data to solve this problem? Once you've done that, you then move into the tools and technology. You learn how to use Excel. So you see the exercise we carried out. This is medical data, and all these charts were built by me using Excel, Microsoft Excel. And you will be doing the same this time around, not just with Excel, but with more tools and more technologies. Okay. So you're going to learn how to use Excel. You learn how to use SQL, structured query language. And the reason why you need this is because hospitals have sensitive data. The data is so sensitive. There are regulations around how you store the data, who has access to the data, and so on and so forth. So your data would not be in any flat file or any CSV files and so on. Your data would be in a data warehouse or in a database. So how do you access the database or the data warehouse? You need SQL, structured query language, to access the database. The database is simply a central location where the data is stored, and there is access control. So not everybody would have access. But as a healthcare data analyst, a pathology data analyst, medical data analyst, you will have access to the data to extract, analyze, and you bring up your findings for the management to take decisions. You would learn Power BI to visualize your data. So that dashboard I showed you, that we all got the answer when you looked at the charts, you can do the same using Power BI. You can do the same using Tableau. The difference is Power BI and Tableau are far more powerful than Excel. You can handle more data. You can churn out more visualizations, and so on and so forth. You would learn data storytelling. How do you tell a story from the data you've analyzed? Your chief medical officer, the chief medical director, does not understand what Excel does, though they have no clue what Power BI or Tableau is. It's your responsibility to communicate to them in a non-technical manner that they understand what you're saying. And that's data storytelling. You'd learn Chat GPT, AI, generative AI for data analytics. How do I become more efficient? How do I do things 2 times, 3 times faster using generative AI tools like Claude, Chat GPT, and so on and so forth? And of course, you'd learn Microsoft Fabric. And the reason why you learn Fabric is simple. Fabric gives you the opportunity to collaborate in a central environment. So somebody can be working with the Sussex NHS Trust. The other person works with um, South Tees NHS Trust. Okay. And you can work in the same environment analyzing data. The person in Sussex can do what? Create a data warehouse and analyze the data with, Excel. And the other person in the other NHS trust can use Tableau to analyze the same set of data. And that's what Microsoft Fabric helps you do. So it gives you a unique set of skills where you have the opportunity. And this is what employers want from you. Employers are hiring candidates that know how to use Microsoft Fabric. Okay, so these are the tools and technologies that you need to learn. So now that you know that I need domain knowledge, it's either I currently have experience or knowledge because I work in healthcare, or if I don't, I can gain that knowledge by working on projects. Okay, and I'll show you how. And then I need to gain data analytics skills. But how do I learn the skills? Very important. Not on YouTube, not on Udemy, not 100% self-paced environment. Because if you are doing that, your journey is going to be far longer, far more difficult, and the chances that you'd achieve your eventual goal is close to zero. I've been there before, so I'll tell you from my own experience. Okay, so how do you learn? What's the best way to learn? You must learn in a project-based environment. And what does this mean? If you want to become a mechanic, you must fix cars to become a mechanic. If you want to become a medical doctor, you must treat people. You must understand all the nuances involved in treating the process and so on and so forth. You go for your after you're done with medical school, you have to go work first of all, do an internship and so on before you housemanship and all those things before you eventually get into the main job itself. You can't become a nurse by watching videos. You become a nurse by doing the work of a nurse. So you learn in a project-based environment where you are learning by doing the job. That's the only way you can learn to get into health tech. If you are doing it any other way, you are making a very big mistake. Okay. And when you do that, nobody knows you. Nobody knows how good you are. Nobody knows what you can do. So you must have a way to showcase your skills, showcase your knowledge by doing what? Building a portfolio. So take it like you bake cakes. For anybody to buy a cake from you, they want to see the type of cakes you've baked before. So they want to walk into a store, they want to see your cakes, and they know that yes, you can bake a cake. Or you're a tailor, you sew dresses, wedding dresses, and suits. I want to walk to your store, see the type of suits, see the type of dresses, and decide that yes, you have very good finishing, the material are quality materials, and so on and so forth. That's the same way you must have a portfolio as a healthcare data analyst. You must showcase that you've worked on multiple projects, you've built and you've done things that people can access and can see the quality of what you've done. If you don't have this, nobody would look at what you can do or hear what you can do. They want to see what you have done. Okay. So this is the best way to learn. You learn in a project-based environment and you must showcase your work by building a portfolio. So, Victoria wants to get a job, for example, with the NHS as a healthcare data analyst. What's the best way for Victoria to learn? She must learn by working as a data analyst in healthcare, and she must have evidence for her work. So I'm going to show you what your portfolio looks like and what evidence looks like. For somebody like Victoria, okay, so sorry, I'm going to mute everybody again. All right, so we can't unmute and distract. Thank you very much. So the advice to Victoria is you want to get a job as a healthcare data analyst. You must work as a healthcare data analyst. You must learn by doing the work of a healthcare data analyst. And this is how it plays out practically. Okay. So I'm going to take you to one of the classes. You see how the class, what the class looks like. So first of all, you have access to an LMS, a learning management system. I'm going to come back to this to walk you through this. Okay. Then secondly, you have a classroom. So when you're learning a technology like Excel, for example, I want to show you what a live class looks like. Your live class involves you working with a professional and solving problems together. Okay, I think I'm in the wrong classroom. Yes. So here we are. Okay, so you solve problems together, solving a problem within healthcare. So I'll show you what that looks like. So you'd see your case study. The case study is for a hospital called St. Luke's Hospital. St. Luke's Hospital currently faces so many challenges. Okay. They have issues in their emergency care, in the orthopedics department, and so on and so forth. They have serious operational inefficiencies because their data is unstructured. So you, as the healthcare data analyst, would have to, first of all, make sure that you bring the data into a central location before you start your analysis. So these are the type of problems you're going to work with. And when you solve the problem together with a professional in class, and I'll show you what the classroom looks like, because every class is recorded. In case you miss the class, you can go back to your classroom, you can watch and see everything that happened so you don't miss anything. Okay. So this is the same case study. You are solving this case study together with your facilitator in class. You learn how to do your analysis, the KPI, the metrics you need to focus on and so forth. And you can see people asking questions. You have the opportunity to say, hey, I have a question. I tried what you did. I didn't get the same thing. What do I need to do? So you have that opportunity. When you've done this, you've worked on this project, what do you do? Showcase your work. So what would Victoria do after solving a healthcare project? She creates a portfolio. This is Victoria's portfolio. Okay. You'd see projects in healthcare, deep care hospital, ER analysis. This is a project where Victoria did what? She analyzed data to help the emergency room of this hospital reduce the patient wait time by 15% and also improve the patient satisfaction by 20%. Now, I can read about it, or better still, I can see exactly what Victoria did. So I can come here, click on it, go to Victoria's portfolio, and I can see the dashboard that she's built using Tableau. Emergency room visit dashboard, and I can interact with it. So this is equivalent to you walking into that tailor store to look at the dresses that they've sewn and identify, is this tailor good enough for me to allow them sew my wedding dress or my wedding suit? This is your own store and your warehouse. People can go there, they can see what you've done, and they're confident that if Victoria can build this, then it means that Victoria can actually do the job when I hire Victoria. This is what I mean by learning in a project-based environment and showcasing your work. The link to your portfolio would be on your CV and also on your LinkedIn profile. So everybody can have access to it and they can see what you've done and they're confident that you're the right person for the job. And of course, you work on numerous projects in the pharmaceutical space. You work on projects where you're forecasting the emergency room within hospitals. You are predicting, forecasting wait times, and so on and so forth. And by the time you are done, you'd have completed at least 10 projects. And these projects would be in your portfolio. So when you get into the room, when you interact with a professional who is interviewing you, you can use metrics that are specific to that industry, the healthcare sector. You can talk about length of stay, the admission rates. You can talk about HIPAA. You can talk about the GDPR. You can talk about FIPA for those in Canada and so many other metrics and KPIs. So they know clearly that because you know these terms and you know the different metrics to focus on, then you are the right person for the job. Okay. So that's the second thing you must do. Once you get into the career path, you make a decision today. I want to make a change. I want to move into the next, level of my career journey. I want to move from a nurse. I want to become a healthcare data analyst. I want to leave medical from being a medical doctor, a medical practitioner, a physician. I want to become a medical data analyst. Okay, that's the first thing you have to do. The second thing is, you know the skills you have to learn. and how to learn. You learn in a project-based environment and you build a portfolio to showcase what you can do. The skills are very important because when you get into the interview and they ask you, tell us how you've worked with an electronic medical record. Tell us what you know about readmission rates, mortality rates, bed occupancy rates, the cost per patient, the patient throughput, and so on and so forth. These are metrics that you must know how to speak. And these are the things you learn. We work with you to equip you with those skills so you know exactly what to do when you get into the room. Okay. And of course, we move to number three. Number three is where you gain experience, work experience. And the work experience is absolutely critical. You must show that you've done that before. You've done that job before. This is where you're not telling them what you can do, but you are showing them what you have done and that you're the best candidate for that job. And of course, there are different ways you can build experience. I've shown you one, which is a project you complete in class. So when you jump into a live class, you're working on a project. All those projects go into your portfolio and they become part of your work experience. So for somebody like Pavel, who had no knowledge of anything healthcare, he was a teacher. The way he was able to transition was what? He worked on these type of projects. St. Luke's Hospital, Medex Pharmacy, Green Hill Medical Center, Heartbeat Emergency Room Dashboard. He worked on all these different projects. So by the time he was done, he knew the language, he knew the terminologies, he knew the jargons to say when he went into interviews. He knew how to build those reports. He could speak from a point of somebody who had done the job, not somebody who had read a book or somebody who had, watched a video. And that was how Pavel was able to land that job. Okay. So the project to complete becomes part of your work experience. And secondly, once you are done with your learning with us at 10 Analytics, we move you to our partner company, our sister company, Amdari, where you get to intern. So you do your internship, where you work with other professionals, the things you've learned, you work on more projects, this time around in a collaborative setting. So you learn interpersonal skills, you learn communication skills, you learn how to manage deliverables. Some of you would be the team leads within your own group during your internship. So you learn responsibilities, managerial responsibilities, supervisory skills while you are doing your internship. Because employers don't just want you for your technical skills. They want to also know that you are self-driven. You can stick to timelines, deliverables. You don't need to be micromanaged, and you have good teamwork and interpersonal skills. And the beauty about this is you can also use Tenalytics and Amdari as part of your work experience on your CV and on your LinkedIn. Amdari operates out of London in the UK and also Alberta in Canada, while Tenalytics operates out of Alberta in Canada. And once you've worked on projects, it adds to your experience. You've done your internship for 2 months, it adds to your experience. Remember, you must have evidence, and that's your portfolio. I showed you what a portfolio looks like. Once you've done these three things, you can get a job. Okay? Number one, number two, number three. I explained them. Number three is where you gain work experience. The fourth part is what helps you keep the job, because organizations want to validate that you are who you say you are. You can use the tools and technologies you say you can use, and you are as good as you say you are. So they want to validate from a reputable organization that you can do what you say you can do. You've done what you said you've done, and you are the right person for that job. And that's where your referencing comes in. Now, because you've worked with us, you've completed these projects, we know and we are confident and we can vouch for you. So you use our details for your referencing when you're applying to jobs, and the organization reaches out to us and we provide you with a reference. This is a reference from the Southeast NHS Foundation Trust. And of course, they reached out to me. Hello, Adeza. Dear Adeza Suleiman, we have this candidate who we are currently hiring for a pathology data analyst role. And he has provided your details for us to reach out to you to get a reference. So you can provide a reference by using the form attached to the email, or you can fill this, you can click on this link and fill the form online, and we provide you with a reference. You can't keep the job if you don't have a reference. Every organization will do their background check. Can you use those tools? Where have you used those tools and technologies that you say you can use? Okay, so we got your back when it comes to referencing. And that's the fourth part you need to learn. Okay, number one, you get into a high demand career path. Number two, you must learn the skills. And the way you learn the skills is very important. In a project-based environment, learning by doing the work and showcasing your work by building a portfolio. Number three, you must show that you have experience doing that job through the projects you've completed and also through your internship. And number four, you must have a reputable organization that can vouch for you for the skills and the experience that you say you have. And everything I've said for the last 1 hour can be summarized into learn. You learn the skills, you focus on the skills. Okay. You package, which is presenting and positioning yourself as the best candidate for the job. So, and how does this work? I've talked about some of them. We help you gain work experience. We help you with your CV. We work on your CV for you. We tailor the CV to the industry standard, to what we know would get you that interview. Industry standard, keyword optimized, ATS optimized, so you get that interview. We optimize your LinkedIn profile as well. Okay. We show you how to build a portfolio, which is where all the projects you complete, you put them there. It's evidence of the work that you've done, the quality of the work you've done. You join our mentorship sessions. When you have interviews, what do you need to do? We prepare you for those interviews. And for you to prepare for interviews is very simple and very straightforward. All you have to do is go to your dashboard. Everybody would have a dashboard, okay, in the learning management system. So if you have an interview coming up, you don't need to speak to anybody. All you need to do is come right here, go to where you have interview preparation on your dashboard, and you click on schedule mock interview. You fill all your details. What interview stage are you in? HR screening, first round, select all the details. What's the dates of the interview? Oh, my interview is on Monday. You select Monday. On Sunday, somebody would prepare you for that interview. So you have the opportunity to book your interview at least 24 hours before the interview itself. So even if you have an interview on Monday, the 16th, somebody would prep you on a Sunday, the 15th, for that interview. You post the link to the job, you copy and paste the job description, and finally you upload the CV that you used to apply to that job. And of course, we show you how to apply to jobs, where to apply. So when you have an interview, just come in here, click on that, and you book your interview. I showed you what a job reference looks like. We provide you with that. And of course, when you get the job, on the job support, for some people, you've not worked on some type of project, maybe data migration, just to use an example. Now you get the job, you're on a data migration project and you don't know what to do. So what do we do in that case? We work with you, tell you the type of questions you need to ask, the type of people you need to speak to within the organization, and show you how to figure out that project so you have a solid footing on the job. So when you learn, you package, presenting yourself, positioning yourself as the best candidate for the job, you apply. All right. Now, the application process is the most interesting part because this is where we show you platforms that are paid platforms that normally you'd have to pay to those platforms, but we pay to the platforms and we make them accessible to you. So we get the jobs, we send them to you every Sundays. So before you start your week, you see the jobs you need to apply to. You apply to those jobs in your classroom. So if you go to your classroom, you'd see something called job offers. Okay, you'd see something called job offers under your important materials. I'll just show you very quickly. Um, so you'd see something called job offers. If you go to your job offers, this is where we send you jobs across different regions, from the UK to the US to Canada, jobs that come with visa sponsorship and so on and so forth. From not the generic platforms, not from CV Library, not from NHS jobs, not the generic platforms, but platforms that are paid, and you get access to these jobs when you pay to the platform. So we pay and we vet the jobs, we send them to you, you apply. So you get interviews a lot faster. Okay. We show you how to tailor your CV, tap into the hidden and the paid job markets. And when you do this, that is what leads to the job. So the way you learn how you package yourself, ensuring that you are employable, showing the employer, the potential employer, they are the right person for the job. Your CV only gets you into the room. Likability gets you the job. Okay, so how you start with small talk, how you answer the competency-based questions, how you introduce yourself using a constructive framework called the SEAT approach, SEAT, where S is for your skills. You talk about your skills, your experience, your achievements, and your traits or type of person. We teach you this framework so you understand exactly how to perform during interviews. And one hack we also deploy is this. When you go for an interview, if it is virtual, that's you don't have to go there physically. We tell you to take your mobile phone, okay? You record the conversation so we can hear the questions, we hear your responses, and we listen and review and give you feedback where you made a mistake, where you performed very well. So your next interview would never be the same because you know where your gaps are, you know how to prepare, and so on and so forth. So the way you learn with us is not you'll become transition into health tech in 2 weeks. These are not promises that cannot be met. You are learning for 6 months. It's an extensive journey for you. 6 months learning and 2 months internship. Your internship is with Amdari, our sister company, where you get to do your internship. Now, what we've seen is people getting jobs, just like Sharon. She got her job 3 months into the program. Ikmat got a job about 3 months into the program as well. And the reason is very simple. You don't wait until you are done learning before you start applying to jobs. So you would have learned, within 3 months, you would have learned Excel, you would have learned SQL, you would have learned problem solving, you would have started Power BI. Okay, you might not have finished Power BI, but you'd have started. These set of skills are enough for you to apply to get a job. Just like ICMATs, at that time, the NHS only wanted ICMATs to come with what? Excel and SQL. They wanted an information analyst who had Excel and SQL. And ICMAT was able to do that. She had already done that within 3 months. She was able to apply, and we prepped her for our interviews, and she landed the job. Okay. So 6 months learning, 2 months internship. If you're in the UK, you're in Nigeria, you're in West Africa, you are in Europe, similar time zones, you have a live class on Saturdays. So your live classes are on Saturdays, 11 a.m. to 2 p.m. UK time. For those in the US and Canada, you have a class tailored to your time zone, 6 p.m. to 9 p.m. I beg your pardon, 10 a.m. to 1 p.m. Mountain Time. Now, for those in the UK, that would roughly be 6 p.m. to 9 p.m. your time. So it means that if I'm in the UK, say I'm in Leeds, for example, or I'm in Manchester, I can either decide to join a class 11 a.m. to 2 p.m. in the morning, or I can join a class 6 p.m. to 9 p.m., which is the class for those in the US. So I have a flexible, time schedule on Saturdays for my live class. And if for any reason you miss a live class on Saturday, guess what? The class recordings are always going to be there for you. You go into the class recordings and you can, watch the videos all over again as many times as you want. You are all in a group, a WhatsApp group. If you have questions, you can ask questions in that group. And more importantly, if you are watching the videos, let's say you have time on Monday or Wednesday, and you are watching the videos and you have a question, okay? You've asked your question in the WhatsApp group, but you really want to have a conversation with your facilitator. Say you missed the class on Saturday, you've watched the recording, but I want to speak to a professional. I want to speak to my facilitator. You can book a drop-in session any day of the week. So you come in here, you click a link, it takes you to where you can book a drop-in on a Tuesday, on a Wednesday, on a Thursday, and on a Friday. So you have somebody who would work with you, look at the problem you have, solve it for you. So there is no point you get into the next class with any confusion. So you have a flexible way of learning. Okay. Live classes on Saturdays. Every other day, you are on the learning management system, the LMS. You are watching your videos, completing assignments, tasks, and so on. And of course, if you want to interact with your facilitator, you have questions, you can book a session, a drop-in session on a Monday, for example, on a Tuesday, on a Wednesday. Somebody joins that session with you, help you address the problems you have, and effective learning takes place. That's why our students have been so successful in landing jobs. And on Thursdays in the evening, you have the mentorship sessions. The mentorship sessions is where you have industry experts, professionals work with you. They come in to work, tell you what is obtainable in the industry. We bring people from the NHS. We bring people from different medical institutions to come speak to you. We bring our alumni that have completed the program and gotten jobs. We bring them back to walk you through what their experience is like currently at their current jobs, and then they can answer all the questions that you have. During the mentorship sessions, we also teach you critical skills on how to negotiate salaries before you take that job. We have interview simulation sessions and so on and so forth. Okay. And of course, that was exactly what Toyin moved from Nigeria to the UK. Toyin had a background in pharmacy. Today, she is a pharmacy data analyst with the NHS on sponsorship. So she was a pharmacist in Nigeria. She moved to the UK for her master's, but she wanted more. She knew that I need more to land a job. She came to us. We worked with her, prepped her for our interviews, and Toyin landed a job as a pharmacy data analyst. Another interesting job title that you don't see all over the place. So Toyin first of all got a job as a benefits analyst. That was the first job she got. She moved from a benefits analyst to a pharmacy data analyst role within the same NHS trust. You have someone like Gad. Gad currently works as an ETL developer, also with the NHS. He joined our program in July 2024. By January 2025, he had landed a job as an ETL developer, data warehouse and ETL developer with the NHS, also on full visa sponsorship. You have someone like Mawutin, no healthcare experience, an operations manager back in Nigeria, moved to the UK. Today, Mawutin is a pathology data analyst. Pathology. He works in the division of pathology, reports to the head of pathology, um, accountable to the pathology IT manager, and responsible to the head of pathology. I prepped Mawutin for his interviews. I wrote Mawutin's reference, and he's doing an amazing job. You have someone like Judith. Judith was a carer. Okay. Today, Judith was able to transition into health tech as a business analyst. The same process. All the things I've shared with you today was the same thing that Judith deployed. All right. She learned, she packaged, she applied to jobs, and we did the amazing stuff we do for all our participants, and they got jobs. You have Evelyn. Evelyn is a nurse with over 15 years experience. Evelyn was able to transition. I'm going to play Evelyn's video. I want you to listen to her. Arome, a medical doctor with over 10 years experience, also able to transition into data analytics and so on. But I'm going to play Evelyn's video. You're going to listen to Evelyn, a nurse with over 15 years experience, who was able to transition. Okay. Of course, we've seen Mawutin already. Abigail was a carer in Saskatchewan in Canada. Abigail today is a business analyst with the government of Alberta. Same process. She learned, she joined, our program. We packaged her, tailored her CV. She joined all the mentorship sessions. She got all the strategies that she needed. We prepped her for the multiple interviews when she applied. We showed her how to tailor her CV. And in January 2024, she landed a job with the government of Alberta as a supervisor business services and data analytics. You have Ramat. Ramat was a customer service professional. Today, she's a business architect with the NHS. Same process. And I'm going to come back to Ikmat. Okay. So I'm going to play a video from Ikmat. I talked about Ikmat's story. She was a stay-at-home mom. She had not worked for years, about 4 years. Then she wanted to land a job. She moved to the UK for her master's in public health, but she found out very quickly that she wasn't learning the skills required to land a job. Today, she's off sponsorship, transitioned into health tech as an information analyst. And I want you to listen to Ikmat. I'll probably play Evelyn's video as well at some point. And then you get to learn from these amazing professionals. And I'll show you how to start. For those of you that want to get started, how do you start today? I'll show you how to do that, and we'll take questions before we call it a day. Okay. So let's listen to Ikmat. Yeah, so that's Ikmat right there. It's just a 3-minute video. Sit back, relax, and enjoy Ikmat's story.
Hi everyone, my name is Ikmat, and I was with the March cohort in Analytics, and joining Analytics has been the best decision so far. You know, for me, someone coming from a background of full housewife, because I had to stay back home to look after my child for 4 years, and then wanting to break into something new, wanting to go back into the workforce, you know, wanting to place myself in the society for better job opportunities. So it was a lot, and then I'm glad that Analytics came along, and then they presented me with so many opportunities right in front of me, better opportunities, and then I'm glad I took it. And then also the advice of do not sell yourself short, that Effie is always saying, it is very, very valid, because place yourself right, you know, don't sell yourself short. It's a very, very, very valid advice. You know, in Analytics, they will hold your hands like a child, you know, through the modules. You have the opportunity to go back and study. You have the opportunity to go back and practice. You have the opportunity to ask questions. You know, we have people you can always go back to, even outside of class hours. It's the most amazing experience so far, really. And then another thing is the interview prep, guys. That is another very important thing. I did my interview prep with Mr. Mohammed, and it is the best decision ever, because it was like he saw into the future. He knew what was going to be asked, and I'm glad that I wrote down all the things he mentioned. I went back to practice, and then when it was time for the interview, it was like everything he was mentioning, everything he mentioned, it was just they kept on. And then when I was answering those questions, I was so confident, you know, because I already practiced. I did an Excel test, I did a maths test, and then they were really impressed. And another thing is, guys, it may not come as fast as you expect. Definitely you are going to get some no's, and then you may begin to think you're not good enough. You are good enough, yes. The no's will come, but always take it as a basis for learning and development, because after every interview where I got a no, I always make sure I get a personal feedback. So I work on those feedbacks for my next interviews, and yes, it worked. It really worked for me, because I got my first job 3 months into the program, my first job. But I couldn't take up the job because I was a student, and I was really eligible to work 20 hours. So I couldn't take up the job. 3 months later, I got 2 jobs with full visa sponsorship. And guys, all the other no's before the 2 jobs prepared me for the yeses I got. So yes, the no's will come, but do not give up, because you always have Analytics to go back to. They are the best and the best thing that's ever happened to me. And then yes, and they are the most affordable one I've come across so far, and that's a very good advantage. So yes, Analytics for the win.
So that's Ikmat. A phenomenal professional, phenomenal lady. Ikmat is currently also a coach within our program. Okay, we bring her back for those looking to land jobs in the NHS, for those in the UK looking to also make a transition. We bring in Ikmat. She comes to speak. She comes to share her experience, the things you need to look out for. And she says something very important that she uses data for good. She does data for good. Okay, so that's Ikmat. We saw her profile earlier. Phenomenal professional. That's Ikmat right there, doing amazing stuff. Okay, so how do you start today? How do you get started today? Now, you can't stay where you are. You can't listen to all of this and still remain where you are. You have to make a change. If you want to make the transition, you actually have to make a change. And what's that change? To get started. So the most important decision you take is the decision for you to start. The next cohort starts on the 7th of March, 2026. In a couple of weeks, the next cohort would start. We had the February cohort start last week, the 7th of February. Okay. The March cohort starts on the 7th of March. And I have an amazing discount for anybody looking to start today. All right. If you're looking to get registered today, I have an amazing, amazing offer for you. Now, for you to join, rather than paying the full amount of $1,250, you get a whopping $20 discount where you get to pay just $1,000. And in addition to that, you can also make payments in multiple installments, up to 5 installments. And I'm going to walk you through that. But I have more for you apart from the 20% discount. Okay. First of all, the 20% discount is not available to everyone. It's only to the first 20 people. Because the second offer that I have, we have very limited options, limited numbers that we can take. And I'm going to share the offer with you. Okay. For those of you ready to start, willing to get started, you can start by making multiple payments, multiple installments, but you only start with $200, the first installment. And I'll show you how to get that out of the way. But here's the second offer that I have for you. Now, for those who pay today or who make payment before Monday this weekend, we have just 20 slots available. I can only take 20 people from this call. We have over 200 people, but for this, I can take 20. And what we'll be doing for you is this. Normally, when you register on the 7th of March, when your program starts, would expect that between March and the next 2 months, you would have to learn some skills before you start working on your CV and on your LinkedIn. But for those that pay today or pay before Monday, you get priority CV and LinkedIn optimization. So what does this mean? It means we work on your CV and LinkedIn well ahead of time. So in the next 2 to 3 months, just like Ikmat, who landed a job 3 months into the program, you can start applying. There is no delay for you. You get started immediately. So you skip to the front of the line with priority access. Okay. So your LinkedIn, your CV will be prioritized. Secondly, you join the founder circle. The founder circle is a circle where we have the founders, myself, the co-founder, Ifemena, and we walk with you. Before you start on the 7th of March, we have a session with you to map out the roadmap for you, your career roadmap. Okay. So you're trying to get into health tech. These are the things you need to look out for. These are the things you're going to come across. And we map out your own personal roadmap. Okay. You join our personalized transition session. You have tailored guides on how to apply, where to apply, and you have access to myself and the Femena, the co-founder. Okay. So you have that unique opportunity for the career roadmap. Number three is you have access to the weekly mentorship. So your mentorship sessions typically would start a week after you resume class. So if you resume class on the 7th of March, you start the mentorship session the following Thursday. But for those who pay before Monday, pay today, you will get priority access to the mentorship sessions immediately. every Thursdays. All right. So you have access to learn from industry experts, interview simulations. You'd see what the interview simulations look like. Absolutely phenomenal. So while others are waiting, you are already learning. So you start a lot earlier and you know what time means in this journey. Very important. And of course, you also have exclusive access to our sessions on alternative pathways, visa pathways. So one of our upcoming session is on the global talent visa. Okay, so for those who want to apply to the global talent visa as a global talent or a global promise, we have a session coming up. It's an exclusive session, not for the general public, but you will get access to this session for free. Okay, so you get access to the session for free. You understand what the global talent visa is all about, and this gives you clarity for those. If you have a friend, you have a brother, you have a family member, or you yourself, you want to take this pathway, you would understand clearly what it entails. And one of the things you need to provide when applying for the global talent is a reference. Okay, is one of the pieces of evidence that you need to provide. We provide you with that and at least with two references, depending on the time you'd be applying. One from Tenalytics and one from Amdari. Okay. You also get to work. We work with you directly until you land your first interview. So for those that pay today, before Monday, you get 3 months interview guarantee. So I would work with you personally on a job sprint where we jump on a call together, we apply to jobs together, and within 3 months, you land your first interview in the health tech space. And finally, you have access to lifetime career support. So what does lifetime career support means? It means for the first 20 people to register, even after you are done and you've gotten a job, you have an interview, you want to move from this company to the next company, and you have an interview, we still prepare you for that interview. You need a reference, we still provide you with a reference. And I'll show cases of people that they've gotten, enjoyed that benefit. There was a gentleman, his name is Idris Adebisi. Let me see if I can find him on LinkedIn very quickly, and then I'll come back to show you how to, yes, Idris. So Idris Adebisi, for example, Idris joined one of our programs, okay? He joined one of our programs at Analytics. We helped him. He landed this job with Jaguar Land Rover in Coventry. So he got this job. We provided him with his references and all of that. Now, a year later, he came back to us and said he wants to get another opportunity as a senior analytics engineer. We prepared him for that interview. We provided a reference for him, and he joined this company called QuantSpark in the UK. A more senior role, better pay, but he had access to the lifetime career support. If Idris comes back to us in February 2026, we still prep him for that interview. We still provide him with a reference. Just to give you an example of what the lifetime career support looks like. Okay. So, again, the question is, can you afford to wait? That's the big question you want to ask. So the window for this offer closes Sunday midnight. Again, we can't take everyone. All right. We can't take everybody. After Sunday, you lose the front of the line advantage. Okay, so you get everything I've said so far from start to finish, but the priority access of working with you one-on-one, the priority access of getting your CV and LinkedIn started immediately, the priority access of you jumping into the mentorship sessions, the priority access of you landing your first interview within the shortest period possible, and lifetime career support. If you miss out between now and Sunday making your payments, you will miss the opportunity. So it's either for the first 20 people, whichever comes first, but by Sunday evening, the window closes completely. So for those of you interested in starting, how do you start and how do you get your journey started? Okay. So all you have to do is click on this link. My colleagues would also share the link in the chat, but I'm going to walk you through how to start step by step. Okay. So once you click on the link, it's going to take you into this is going to take you into this page. I'll show you what it looks like. It will take you into this page. You'd see all the courses. Just scroll all the way down to the bottom and you'd see health tech. Okay. You'd see the discounts currently available for health tech. Click on the health tech program, buy now. It takes you to the program itself. Okay. You can see the type of jobs you can apply to and so on and so forth. And of course, you click on what? Enroll now. So if you click on enroll now, it takes you to where you can start. Now you can either start in March or in April. You can choose when to start. However, once you make your payment, you're part of the first 20, the discounts and all the amazing offers are already attributable to you. Okay. But if you want to start in April, but you've made your payment today, fantastic. You have access to the program, you have access to all the amazing offers that I just, reeled out. You can start in April or you can start in March. Okay. But the first 20 people are the only ones that get the opportunity to enjoy the discounts. So let's say I want to start in March. I don't want to waste time. I want to get started right away. I want to make payments in pounds, for example. Okay. So you can change your currency right here to dollars, US dollars, Canadian dollars. You can pay in euros, you can pay in pounds, you can pay in naira, depending. Okay. Now you have three options. You can make a one-time payment of £651, which means you save £315 in total. The 20% discount plus an additional 12% discount because you made a one-time payment. Now you can make it 2 monthly, you can make your payments in two payments. All right. So you make a total of £690, but you make it in two installments, 345 today, 345 in the next month. And you have the other option. So here you save £275 in total. The £20, the 20% discount and an additional 8% discount because I'm making payment in two installments. Or I can choose the flexible option to pay in 5 installments. So I get to pay £766. I'll make my payment in 5 installments, £153 per month for 5 months. And that's the 20% discount you have. So any option you choose, as long as you're making payments and you're one of the first 20 people, you get priority access. Okay. But you get additional discount depending on the option that you take. Most people select the first payment and the second payment because you have more discounts you unlock when you do that. So let's take, for example, I want to make my payment in 2 installments or 5 installments. You can choose any of the options, click on apply discounts, and it takes you to where the discounts will be applied. Okay. So you see all your details. You see your details, you confirm your details, and you can, of course, your next payment comes in on the 14th, okay, of March. So if I pay today, the 14th of February, the next payment ideally comes in on the 14th of March. But because let's assume your payment doesn't come in, your salary doesn't come in until 20th or 25th, you can always change the date. So rather than the next payment coming on the 14th, I can change this to say 25th. All right, click on save. So my next payment comes in 25th and I don't have to pay 14th of March and so on. You come right here, select your information above is correct. You've read the terms and conditions and you click on pay now. Okay, so once you click on pay now, it takes you to where you enter your card details. Okay, I'm just going to enter that. Enter your card details. Enter everything, your full name, postal code, and click on pay. Okay. At the moment you click on pay, what happens? You'll be asked to verify your email, you verify your once I click on go to dashboard, okay, because I've done the process before, I've verified my email already. I get access to the dashboard. But if you haven't verified your email, you'll be required to verify your email, verify your phone number, and you get access into the dashboard. All right. You can see start immediately, taking your courses. You see the health tech course. You click on continue learning. You can start watching your introduction, how to install the tools and technologies, like Microsoft Excel, how to install Power BI, SQL, and the rest. And you have your journey started. So that's how you get started. I can see a lot of traffic on the website of people trying to make payments. Okay. So again, once more, just so that um, we are all on the same page, the discount is for the first 20 people. They get priority access, and you also get to enjoy all the benefits of early going to the front of the line, essentially. So we bring you to the front of the line and you get priority access. So I'm going to take a breather. We'll take questions for the next maybe 10, 15 minutes. And I'm sure you have so many questions for me. Okay. So let me see. I'll take questions from the chat first of all, and then I will, if anybody who wants to unmute to ask questions, I would allow you on mute. Okay. So let me see. I have 7 years as a support worker and have no idea about tech, not even the basics. You don't need any experience, Satya. Okay. You don't need any experience. I want you to listen to somebody, Satya. Okay. She has 15 years. You have 7 years as a support worker. She has 15 years as a nurse, but I want you to listen to her. Okay. One thing I want you to understand is the curriculum has been designed with the beginner in mind. We know you're a beginner. We expect you don't have all the information. We expect you not to come to class with any knowledge. So you have the most patient people that would work with you to ensure that you are able to transition. Okay. So I can see a lot of activities on the website of, I think, I'm not sure of the exact number of slots we have left available, but I'm going to take questions. I want you to listen to this amazing lady, and then I'll come back to take more questions. Her name is Evelyn. I think I have Evelyn somewhere here. If not, I'm just going to search for Evelyn's video and you're going to listen to Evelyn. Um,
Hi everyone.
okay, yeah, that's Evelyn right there. So please listen to Evelyn. It's just for 1 minute. And Satya, this would help you understand that if Evelyn can do it, you can do it as well.
Hi everyone. My name is Evelyn. I joined the Analytics January cohort, and it's been a good experience since then. Been in nurse for 15 years, and never did I imagine I'd change my career. But in a way, it kept coming up to my mind that I just needed to do something else. So I saw the advert on Instagram, got in contact, and ever since starting the course, it's been, I wouldn't say it's been easy because you do need to dedicate time, study, work hard. But Analytics have been quite supportive. I just want to give it to Analytics. They made sure they packed all the skills that's needed to be done. But I'm very sure it's worth it. Since starting, slowly but surely, I'm building my confidence. I'm starting to try to call myself a data engineer, all thanks to Analytics. And that confidence, they will instill it into you, and you can do it. Whatever line of work you've been in for years, you will. Yeah, it's just that confidence of working hard, practice, practice, practice. And I've never for a day regretted it because I'm definitely going to be a data engineer. That I'm sure of. Thank you.
Hello, everyone. Okay, so that's Evelyn, 15 years in nursing, and Evelyn is transitioning. Okay, and she said something very important, which is practice, practice, practice. You dedicate time and you get that done. Okay. How do you know exactly which area to learn? Which area is better for you? I told you already. Chukunecherem. Okay. If you want to make a transition into the health tech space, you want to look for domain knowledge in healthcare, couple that with data analytics, and that's what gives you opportunity. Okay. I'll take more questions. I made a mistake. Rather than pay for health tech, I paid for data analytics. It's not a mistake, E. Okay, you didn't make a mistake. What you need to do, just send an email to admissions at 10 Analytics. I'll show you the email to use. Just send us an email to admission at Tenalytics. Okay, admission or admissions, any of the two, the email would come to us. Send us an email here, or you can send us a WhatsApp message on any of these numbers, and somebody would respond to you. All right. Okay. Okay, so let me take questions from those who have their hands up. I'll start with Ido. Ido, I've asked you to unmute yourself. Please go ahead, Ido, and let's hear from you. What's your question, Ido? So where are you joining us from? And go ahead and ask your question. I've asked you to unmute.
Yeah, guys, good morning. Sorry, good afternoon. Um,
Hi, Ido. How are you doing today?
joining, I'm fine, thank you. I'm joining from Canada. I actually
Fantastic.
joined the last week webinar. I've
Yes.
forgotten the anchor of the webinar, I've forgotten her name. She's a lady, and she
Okay.
was so fantastic. So immediately I enrolled for the class.
Yes.
But I decided to join today because I've been trying to contact analytics so that they
Yeah.
can change my cohort to February, but
Okay.
I've not been able to do that.
Okay.
So I don't know
Have
if
have
it
you
is
sent an
possible.
email? Have you sent an
I
email?
actually sent an email to is it I've forgotten her name now.
Okay.
I sent an email to an individual, I've forgotten her name. She said she will get in contact with those that can help, that they will
Yeah.
get across to. She actually said she has sent the request forward that they will get
Yeah.
in contact with me. But up till now, nobody has got in contact with me.
Yeah. All right. It's not a problem at all, though. It's simply because your program would start on the 7th of March. So
Okay.
somebody would get in touch with you before that time, but you can rest assured that that has been sorted out. Okay. Just for you to be doubly settled, you can send another email to admission@tenalytics.io. But I can tell you for free that as long as you sent an email to somebody, they've confirmed that they've sent in the request, that would have been sorted out for you, and you'd get all the new details into your email before your program starts. Okay?
All right. Then another question is, you said those people that will be joining today, the first 20 that will be
Yes.
joining today, will be having some opportunities,
Yes.
which was not given last week. I just want to
Yes.
confirm if we that joined last week as well, we have those opportunities.
Yes, you will. You really do.
All
Okay.
right. Thank you.
Um, you're welcome.
Thank you for the
Okay.
good job. Thank you.
Absolutely. Thanks for the question, Udo. So I'll check the chat to see more questions. I promised I was going to show you a website the other time. I almost forgot, but I'll show you that now. Okay. So it's a platform called JobRight. We've been using the website for about a year and a half or thereabouts. It's one of the most phenomenal job boards you'd ever get to work with. Okay. A lot of the things here on JobRight are paid. So it's one of the platforms we also pay for, and we help you get jobs to apply to. All right. Now, JobRight is predominantly in the US and in Canada. Okay. So for somebody like you, though, this would come in handy and very useful. Now, let's do a search for the healthcare data analyst role. Okay. So I go on search healthcare data analyst. So I select that. Okay. Now I have 4,597 results, jobs that are waiting for me to apply to. 4,597. And I can come down here to change it from the US to Canada. So JobRight only scraped jobs for people in the US up until recently. I think about a few months ago when they added Canada to the list. All right. So these are some of the amazing platforms that you get to experience, okay, including others, obviously. So this job was posted about 5 hours ago. Whoops. Okay. It was posted about 5 hours ago. You already have about 200 applicants, people applying to jobs. And one of the things you can also do is you get notifications the moment a job you want to apply to becomes available, and you go ahead and apply. Okay, so many roles within the healthcare data analyst role. Here, for example, this was posted a week ago. You have only 63 applicants. All right, and these are the type of jobs you want to look at. We show you how to tailor your CVs, and then you put in your application and you go ahead to apply. Now you get recommendations. So you can see 84%, 81%. These are recommendations on how your skills currently match that particular job. So 84% means the CV that I uploaded, which is a CV of, somebody who joined one of our programs, the experience level is 72, skill level is 100%, industry is 42. So how do you boost your industry experience? By working on projects, by tailoring your CV. So we show you how to do that. You tailor your CV, increase the industry experience, and overall you want to get 90 to 95% before you go ahead and put in your application. Okay. And that's what ensures that you get the interview. And when you get the interview, what next? We prep you for that job. And when we prep you for the job, the chances of you landing that job becomes a lot higher. Okay. So that's just one role. I can come in here and type in another role. We can try healthcare informatics, for example. So healthcare informatics. Okay. And here I have about 7,816 jobs. So like I said earlier at the beginning when we started, the demand for career path within health tech is unbelievable. Okay. And you have the opportunity to get into this area. Like I mentioned, within the next for the UK, there are so many platforms. Okay. So one that easily comes to mind, I'm going to show you that very quickly. Okay. So one that easily comes to mind, let's just check this. Okay. NHS jobs is one that is very good, but this is not a paid platform. Okay. One of the paid platforms we use is UK visa jobs. So UK visa jobs are jobs that come with exclusive visa sponsorship. So we scrape jobs from the UK visa jobs and we send to you. So here I can come in and I can just simply type data analyst and I can search, and it gives me, this was where I got the screenshot I shared with you. Okay. The pharmacy, clinical informatics, and data analyst. Okay. So you see jobs within the space: medical devices analyst, senior information analyst, and so on and so forth. I can simply just check for NHS. I go to the NHS jobs. I showed you a screenshot the other time where you have 3,080 jobs available. Okay. Let me see. Okay. So search for jobs and we simply just type data analytics. Okay. Data analyst search. So it was 3,080 as of yesterday evening when I took the screenshot. But here we have 3,077. So it's dropped by three. Okay. So here you have vascular data analyst and clinical governance coordinator, data engineer, data lead, data administrator, workforce analyst, applications analyst, data quality assistant. And there are 308 pages. You can go through and keep on looking at the jobs available and so on. And again, like I mentioned earlier, how do you tailor your CV to these jobs? That's what determines if you get an interview or not. And that's where we do an amazing job. Rebecca is saying, I have a master's in public health, but little background. I want to go into health tech. Which healthcare tech will be good for me? If you are exactly a replica of Ikmat. Ikmat had a master's in public health. Today, Ikmat is a what? She's an information analyst. So one thing you need to understand based on your question is simple. Because I have a master's in public health and I've learned data analytics like Ikmat, does not mean the only type of job I get is as an information analyst. No. Mawutin did exactly the same thing. Okay, I'm going to look for Mawutin and share. Mawutin studied data analytics with us, but Mawutin did not get a job as an information analyst. He got a job as a pathology data analyst. So there are numerous career paths within the same ecosystem. Clinical data analyst, pathology data analyst, information analyst, medical data analyst, and so on and so forth. We saw one that was very interesting a few minutes ago, and that is the role of pharmacy, clinical informatics, and data analyst. Okay. Again, another lady, Toyi had a background in pharmacy. She joined our data analytics program. And Toyin did what? She got a job as a pharmacy data analyst. So the health tech program takes you coupled with the data analytics skills, and you can land jobs in multiple areas from healthcare data analyst, healthcare data and reporting analyst, pharmacy data analyst, just like Toyin. And that's how you transition. Okay. Um, I'll see if I have more questions. We have a lot of people with their hands up. We have just, I think we have about 11 slots gone already. Okay, I'm just going to confirm that from my colleague. So Arafat, you can confirm from me, confirm for me, please, how many slots we have available to get to 20. I'm from Canada. I did my master's in pharmaceutical sciences. Will I be able to get a job after completing this course? Absolutely. There are so many um, medical institutions, depending on the province where you are. I'm in Alberta, for example. You have the Alberta Medical Institution. They're always hiring. You have the same platform I showed you, JobRite. They're always hiring. You have jobs available there. Okay. And so on. Um, to answer your question, you are in Toronto. Fantastic. Okay. So what you want to do is to get started. Okay. Don't miss out on the discount. Don't miss out on being one of the first 20 people. I need to do a refresher course. What do I do? Do I have to pay again? Ifoma. So when did you join Ifoma as an ex-student? You should have access to your LMS and your classroom. Okay. So one of the things you want to do is to start from there. 2024. When in 2024, Ifoma? Just quickly confirm when in 2024, and I'll tell you in March. Okay. So what I want you to do, Ifoma, is you'll have access to your classroom. November, you have access to your LMS, Ifoma. Okay. So what you want to do is go to your LMS, go to the program you've registered for, and you have access to everything in there. Okay, you have access to everything. So this is the health tech program, for example. You start with Excel, you move to Power BI, you move to SQL, and so on and so forth, with a focus on healthcare data. Okay, so what I want you to do, Ifoma, is go to your classroom, go to your LMS, and you have access to all the materials. If you have any questions, you are a bit confused and so on, what you want to do is go to your dashboard, schedule a mock interview session, have a conversation with one of your instructors. Okay, but if you want to start again from scratch, perhaps you want to do a different program, you want to do the health tech program, you have a discount, an additional 5% discount as a returning student, but you'd still have to pay. That's a direct question you're asking. To answer your question directly, but you get a discount for being an alumnus of Tenalytics. Okay, so E is asking, if the class begins in March and you have made payments, how can you begin to get yourself into the groove? That's exactly what I said, E. So in the coming week, we will reach out to you and we get started with your CV. We get started with your LinkedIn session. You join the founders inner circle and we work with you to start your career road mapping. You already have access to your LMS. You can start to download your tools and technologies and so on. So you get started before the 7th of March. That's for the first 20 people, like I mentioned. For others, on the 7th of March is when you start. Are you giving certificates, IIBA, Dr. Tibe? I'm going to talk about that a little bit, okay? Because it's one of the misconceptions that a lot of people have. So whenever I have the opportunity to clear that, I always like to do, okay? So Dr. Tibe, this is what one of the first things you get to do, you get to learn when you join Analytics is this. We follow a particular mantra, which is competence over credentials. Competence over credentials. Your credentials are your degrees, certificates, and so on. Pardon my handwriting. Okay. While your competence comprises of your skills, okay, your skills and your experience. If I ask you, as a healthcare data analyst, as a pathology data analyst, from all the things you've heard me talk about today, which is more important, your skills and experience or your degrees and certificates? Your competence. Nobody would hire you as a healthcare data analyst because you have a certificate somewhere. No. All the people I showed you, from Ikmat to Ramat to Abigail, who is in Canada, to so many professionals, their certificates did not get them the job. In fact, they had certificates but could not land a job, and that's why they came to Tenalytics. Okay, so competence over credentials, a focus on your skills and your experience. Every single employer today knows how easy it is to get a certification. Very easy. Oh, I want to write the Scrum Master certification. I want to write the IIBA CBAP certification. All I need to do is to study for 6 weeks. I sit down, write the exam, and I pass. But can I do the job? No. And that's what I've seen. A lot of business analysts who don't know how to use Power BI. They don't know how to use SQL. They don't know how to use Excel. They cannot draw a simple process map using draw.io or Lucidchart. They don't know how to track deliverables. So what I advise you to do before you think of that certificate is what? Skills and experience. If you want to have the certificate as a feel good, as a bragging right, then you can go ahead and do that. But what ensures that you know how to do the job on day one is your competence, your skills and experience, not any certificates. Okay. Um, Yes, you get a certificate when you're done. I'll show you what a certificate looks like on LinkedIn for people that post when they are done. Okay. So let me just do a random search. Tenalytics certificates. Okay. So let's see if we can find anybody who posted recently. And I'll just show you what it looks like essentially. Yeah. So for example, this was 1 year ago anyways. This is Bosa. You can see certificate presented to Bosa Tuko. He joined our data engineering program. Let me see if I can see more posts. Okay. I'll see if I can find more people with their certificates. Yeah, this is another person. This is Sydney. He posted his 4 months ago, my Tenalytics journey. I'm super excited to share that. I've officially completed my data science training with Tenalytics, earned my certificate, and that's it. Okay. So you have more people like that would have made, different posts, different people that have joined, and so on and so forth. All right. So, but always remember, like I said earlier, your focus is always on what? Competence. I hope I answered your question. Let me see from Komal. I'm currently working in healthcare as an agent for health insurance and telemedicine companies, and I have experience as a senior level BA with 10 plus years experience in banking in IT. I'm looking for support for work from home job in healthcare, business analysis, or project management. Is this something you guys can help out? Absolutely. So what you want to do, Kamal, in your own situation, you're very specific. business analysis or project management. But looking at your experience, my advice for you would be to go for the business analysis. Okay. And all you have to do, Kamal, is still the same link that I shared with you. Click on that link and let me show you where you go to. Okay. So click on the link. When you click on the link and you see all the different courses, okay, you'd see what? Business analysis. Click on business analysis. You have access to the same 20% discount. Okay, rather than paying 1,250, you can go ahead and pay just 1,000, and you can break your payments into at least a maximum of 5 monthly payments. So you can make your payment depending on where you're paying from. You're paying in pounds or US dollars and so on. You can make that payment in multiple installments. And for those going for the health tech, if you scroll all the way to the bottom, you'd find health tech. You click on that, you'd see the difference, read about the course, read about the program itself, the job opportunities. Like I mentioned earlier, you don't just get a job in one particular area. You can get a job as a healthcare business analyst, healthcare informatics specialist, healthcare data and reporting analyst, medical data analyst, healthcare data analyst, healthcare process analyst, and so many others, pathology data analyst, and so on. Okay. So that clearly shows how to get started. I need clarity on a particular question. I'm currently undergoing a support worker training course and won't be able to start health tech now. I have always wanted to transition into tech and would have taken this opportunity if I saw it earlier. Now, my question is, will I have access to join a cohort once I'm able to? That would definitely be this year. In addition, will there be the same discounted? Yes, you can join a cohort later this year. We have cohorts from January all the way to December, and we've done this for the last 5 years. Health Tech is one of the programs we started offering as an offshoot from data analytics. Okay. For the last 5 years, every month you have a new cohort starting. So we had a cohort that started in February. We have a cohort that will start on the 7th of March. We have a cohort that will start in April. The only difference is the discounts. So the discount is available now. It won't be available in perpetuity. Okay. So yeah, you can always come back. Would always be looking forward to having you in the program. You're welcome, Komal. All right. So we spent about 2 hours so far. Something I want you to do, every single one of you. All right. Go on YouTube. Okay. So go on YouTube, search for Tenalytics on YouTube. Okay. Search for Tenalytics on YouTube. That will take you to the Tenalytics page. Make sure you subscribe. Click on the Tenalytics logo and it takes you to our YouTube page specifically. You'd have access to content that we've curated over the last 5 years. Okay, you can watch them for free. You'd also see the alumni job success stories. You'd see people like you who are in care. You'd see people like you who are support workers, people who were medical doctors, who were nurses, and they've transitioned. Okay, this gentleman right here transitioned into business analysis at the age of 60. At the age of 60, he worked with the civil service in the UK, but he currently got a job as a business analyst. No, the specific job title is Health and Safety Data Analyst with the Home Office after the age of 60. Is an interesting one for you to listen to. Okay, so if you click on alumni, you can watch about 182 videos of professionals who have created videos so you can hear their story and get to learn from them. Okay, absolutely phenomenal professionals. I want you to do that and also follow us across all the platforms from LinkedIn to Instagram to Facebook, and so on. So you're one of the first people to see what the amazing stuff we put out there for you. I'm trying to choose a career path, BAPM engineering. So what I want you to do, Franny, at the end of this session, my colleagues, if you're in the WhatsApp group or you've received an email from us, we will send you an email. Okay, for those of you that have filled the attendance form as well, you'd get a link called the clarity session. Okay, you can book a clarity session where you get to interact with our career coaches. So our career coaches would get all the questions you have. So for you want to know if you should do BA, PM, project management, or I believe that's data engineering or cybersecurity. So you have four very, contrasting career path you're interested in, Franny. So book a clarity session and somebody would help you navigate that path. Okay. Nancy is asking, what about opportunities in project management in healthcare? The healthcare sector has numerous opportunities for the HR professionals, for the project management professionals, for cybersecurity professionals. The most important thing is for you to learn the skill in project management. If you go to any of the platforms I've shared with you today, okay, so I can go to NHS jobs. Okay, the NHS is in healthcare, and I'm just using this as an example. And I type project management or project manager. Okay, and I search. You would see numerous opportunities for the project manager in healthcare. But how do you get a project manager job in healthcare if you don't have the skills in project management? Okay, so what I advise you to do, Nancy, and these are some of the questions people always ask. Oh, Adeza, I have experience in this. How do I get a job in this particular sector? I've given you the blueprint already. Okay, if you have experience in healthcare or you don't, you want to get into project management in healthcare, what do? You learn project management and you leverage healthcare projects. So you want to look for healthcare projects within project management to showcase that you've done projects within the space. And one of the things you'd see across all the projects that we complete is you don't work on a single set, on a specific single sector. Even the health tech professionals, you get to work on projects in a few other sectors. So you understand what it takes to analyze data in other sectors beyond just your sector. So you work on projects as a project manager is not tailored to health tech, like the data analyst in health tech, what I've shared with you today, but you'd learn the project management skills. And the focus for you would be to look for projects and work on projects within healthcare. So when you get into an interview for this role, for example, you can talk about projects that you've completed within the healthcare space. So you can see that project manager and so on, project manager within the healthcare space. So what you want to do, Nancy, you want to get into project management, very simple. All you do, like I advised the other gentleman, okay, when you click on the link, the same link, go to Agile Project Management. And the beauty about Agile Project Management is you learn more than being just a project manager. You can apply to jobs as a Scrum Master. You can apply to jobs as an Agile coach, as a PMO analyst, and so many other roles. Okay. So that's what I advise you to do, Nancy. References for background check will be given. Absolutely. That's a no-brainer. Okay. That's the easiest thing for us to do. The training is for 8 months, 6 months learning, and 2 months internship. Your internship would be with Amdari. Okay. So Nancy, you also have advantage to take the discounts. Okay. So the discounts of 20% where you have the opportunity to also make payments in multiple installments. Okay. Instead of 1,250, you get to pay just 1,000. Okay. So if you click on enroll now, it's going to take you to where you'd see the payments plan. So depending on where you are paying from, if you are paying from the US, instead of paying 1,250, you get to pay just $1,000. if you're making payments in 5 installments, okay, you save $250 because 1,250 to 1,000. But if you're making a payment in 2 installments, 450 now, 450 in the next month, you save $350 because you get to pay a total of 900. And if you're making your payments as a one-time payment, that's where you unlock amazing savings. You save a total of $400 instead of paying 1,250. You get to pay just $850. And this discount is applicable to all the programs. Okay. But for the health tech, you have a unique flair to that, additional offers for early CV, early LinkedIn, and so on and so forth. Okay. The $200 give us access to the training. Absolutely. With the $200, you get started on the 7th of March. Your cohorts would start on the 7th of March. Okay. That's when you start. And I walked you through, for anybody who has registered, if you go to your dashboard, your billing history, you'd see when your next payment would come in. Okay. So I've used this account for multiple, examples, and that's why you can see a whole lot. But here, if I make my first payment February 14th, the next payment comes in March. I changed mine to March 24th. So while you're making payments, you can edit the dates. If your salary doesn't come in on the 14th, it can come in, say, 26th, 27th, the date that you receive salary or the date you receive payments. You can always make that change. And you can do it here in your billing history as well by clicking on request the grace period, or you simply just send us an email to accounts@tenalytics.io and somebody would address any questions that you have. All right, I think we're going to call it a day at this point. Thank you everyone that joined the session today. If you had a great time, I want you to type into the chat, yes, I had a great time. If you had a great time in today's session, type in a yes into. Okay, I can see Ade. Ade has his video on. Um, okay. Hi, Ade. How you doing? Thanks for joining us today, and I'm sure you had a great time. Fantastic. Now, like I mentioned earlier, you don't want to take information like this. If for some of you, perhaps this doesn't apply to you, you want to do something else, but you know a friend. We had somebody who recommended her friend. She had gotten a job and she recommended her friend to also do the same. And guess what? Her friend also landed a job. Somebody's elder brother joined a session like this. He didn't need it because he had a job, but he sent the information to his younger brother, and his younger brother was able to join. He landed a job. Okay. So share this with a friend, share it with a family member, somebody you think this would benefit, and get them started. All right. Thank you very much, everyone. Follow us across all platforms, and I would look forward to working with the 20 of you taking advantage of the discount. Don't miss out on it. We even have oversubscription, more than 20. Okay. So I think what we're going to do is for those who pay within the weekend, today, Saturday, Sunday, for those who pay, we will be giving you priority access to the amazing stuff we have for you. All right. Thank you very much. Have an amazing weekend, and I'll see you in some other session. Cheers, everyone.